Bella Vista Community Television presents Senior Happenings with our host Tricia Ayers. Her guest today is Will Corporon, and we will be talking about Medicare.
Well, hello everybody. My name is Tricia Ayers, and I am your host today for Senior Happenings. And if you're like me, you got one of these in the mail. Yes, it came to our house. I'm sure it came to many more households. I think about 64 million people probably got this, so I don't feel left out. And so we are going to talk about Medicare, what's coming up, and we have some exciting information at the end of the show that we'll share with you also. So our Medicare expert today is our good friend Will Corporon, who lives upstairs.
Yeah, well, yes.
Yes, his office is upstairs.
Office is upstairs from
Yes.
Bella Vista TV.
Yes.
Yeah, 12 years now.
12 years.
Yeah, I've been upstairs 12 years.
Wow. So welcome to the show, Will.
Thank you very much. Thanks for having me.
And I do mean that you are our expert. I've heard you speak for many years. You always give great advice.
Well, I appreciate that, and it is very timely as we're getting ready to start Medicare's annual election period, which is coming up in about 2 weeks.
Ooh, October 15th, yes?
October 15th. And the new plans, everybody's kind of curious about the new plans. The new plans will be revealed, so to speak, unleashed on October 1st. So Saturday is actually the first day that we can legally, we being agents, can legally talk about the new Medicare Advantage plans and drug plans that are coming out. Even though we've been, learning about them and studying them and going to meetings and attending Zoom online, all this for a couple of months now. But Saturday is the day that it's unleashed. And a new barrage of, no doubt, Jimmy Walker and Joe Namath commercials will be coming soon, and William Shatner, because you got to make sure you get all the Medicare benefits that you deserve.
Right.
That you deserve.
That you deserve. So one thing that you said there, important, you are a licensed specialist in
Correct.
this field.
I'm a licensed agent in order to discuss and more importantly enroll someone or recommend a plan. That recommend is the word.
Okay.
Because you can go get help. There's help all over. You can get help from the Schmeeding Center. You can get help from the Area Agency on Aging. You can get help from the great folks at RSVP with Medicare. But they can't legally say, oh, I think you should do this plan. Mm-hmm. They can go to Medicare.gov. They can say, well, here's a list of plans. They can use this and with you and open to the back where it has all of the things, and you can look down all the plans and then they can say, oh, well, here are a few, but then they can't say, I think it's best if you do this.
Right.
And that's really, to me, very important. One of the things that we do in my office is we represent, I won't say all, but most of the insurance companies, certainly in the 4-state area, definitely in Northwest Arkansas. So if somebody comes to talk to me about Medicare, I'm not just talking to them about company A or B or C or D. I'm talking about the entire alphabet of plans that are available.
Right.
And then we drill down and choose whatever plan, Medicare Advantage plan is best for them, or if they're new to Medicare, maybe they would like a Medicare supplement and a drug plan, or maybe they just need a drug plan, or maybe they're going to keep working and say, well, I want to go ahead and sign up for Medicare, but I'm going to keep working for a few more years because I have good health insurance through my work.
Right.
So these are all the considerations that people have. It's definitely not a simple, close your eyes and go, that one.
Right.
You can really cost yourself thousands of dollars.
Right.
And I don't know anybody today, after the loss of, how many trillions of dollars in the stock market and retirement plans and such within the last, months. I don't know anybody today who is going into this winter feeling like, daddy warbucks, like they can afford to spend extra money next year on medicines, even if it's $1. even if it's $2, right? Or maybe it's the gas in the car because you're going to the pharmacy to pick it up instead of having a plan that you can really trust for mail order where you don't even have to go. So all these things come into play. And we, of course, I love it. This is my 20th year
Wow.
in business, not only with Medicare, but with health insurance, life insurance, and financial services, retirement planning, and that sort of thing. But I tell people Medicare is my hobby. I'm really a financial advisor, but I dabble in Medicare. So
I feel that you're an expert. I do. I truly do. Now, I said this beautiful piece of expensive paper came through our mailbox, and I'm not quite there. But I'm getting there. So
your husband got this?
My husband got this. So if it was me, if I am new to the Medicare process and I signed up at the appropriate time and I came to you, what would the office visit look like?
Well, so let's back up a little bit.
Okay, yes,
Because
please.
very often the first call I get is somebody saying, I'm going to be turning 65 in 6 months. What are my options? What do I need to do? And just real quickly, and there are a lot of people who are still working beyond, Medicare age, which is 65.
75%, I heard.
Right. Well, your full retirement age right now is, I think people that are getting there is 66 and 4 months. And I think in the next year it goes to like 66 and 6 months. And eventually it'll be 67. When I'm there, it'll be 67, a few more years. So a lot of people are not wanting to quit work until they get that full retirement age, because the bump in Social Security is about 8% a year. Well, if you can get 8% on your money by working an extra year, for a lot of people that makes good sense. So Medicare and Social Security are not timed up.
Okay.
You can have Medicare. Medicare is 65. You can start Social Security at 62 and delay it all the way up to 70.
Okay.
So anyway, if somebody came to me and said, hey, I'm going to be turning 65, or I'm almost 68 and I've never enrolled in Medicare because I've been working all these years, then we have a conversation about, okay, let's get you enrolled, let's get you signed up for Medicare. But assuming that you had done that and you came in and you had Medicare A and B.
Okay, which is what? I'm sorry.
Medicare Part A is, on the Medicare card it says hospital for Medicare Part A. And on the card it says, for Medicare Part B, it says medical. The best way to think about that is inpatient and outpatient. So Medicare Part A is inpatient, Medicare Part B is outpatient. Medicare Part A, for most people, there is not a cost.
Okay.
It's not 100%, but the vast majority, probably 99.5% of people, there is no cost for Medicare Part A. And the reason for that is because you've paid for that through your working years. Okay? There is a cost to Medicare B. And you teased it earlier at the opening of the show. We just got, and I have it right here in my hot little hand, they just released the new costs for Medicare for next year for Medicare B. But we're going to save that till a little bit later in the show, and then we'll discuss it.
Right.
So Medicare B has a cost. Medicare B is the outpatient part of Medicare. And you have to pay for that. The current 2022 rate is about $170 out of your Social Security per month. And if you're drawing Social Security, they take it out before you ever see it. If you're not yet drawing, they send you a bill quarterly and you pay it.
Okay.
In order to have a supplement or an advantage plan, you must have both Medicare A and B.
Okay.
A lot of people want to get out of paying the $170. Can't do it. I mean, you have to have it. It's required. If you drop that, you're going to lose your coverage. And then it's hard to get back in, and there's a time frame, and there are penalties, and it's a mess. So assuming you've done everything right, and you have Medicare A and Medicare B, the first thing we're going to talk about is which kind of Medicare plan do you want? Do you want the supplement and a drug plan, or do you want an advantage plan? Those are the two tracks. Now, you don't have to have either. You could just have basic Medicare A and B. But you don't have, if you just have Medicare A and B, you don't have a maximum out of pocket or a stop loss. meaning your out-of-pocket costs with only Medicare A and B could be $200,000 in a year, okay? Because there is no maximum out-of-pocket. Medicare B, the outpatient part, is an 80-20. Medicare pays 80% of approved amount, you pay 20%. But there's no point when you've paid $10,000 and they say, oh, you've paid enough. You know, you don't need to pay any more than 20%. That's open-ended.
Wow.
Okay? And on long extended hospital stays, like over 60 days, I mean, you're paying $400 or $500 a day from then on, every day. And it all adds up, and it never stops. Okay, and that's per year. So anyway, I never recommend that somebody just stays with Medicare A and B. The potential loss is way too much. A supplement, like, and these are sometimes called Medigap plans or Medicare supplement, fills the gaps after Medicare pays. So with a supplement, Medicare pays, your supplement pays according to its schedule, and you may or may not have a little bit left depending on the plan you have, okay? And we won't get into that, but depending on the plan.
Sure.
Now the main thing to know about supplements is you have to pay every month for that supplement. You're paying a premium, just like an insurance plan, like your car insurance or your homeowners. You're gonna pay, and it could be as low as $120 a month, or it could be as much as, after several years, several $100s a month. My mom in Kansas City has had the same plan for a long, long time, and you couldn't pry it out of her fingers, right? But she's paying over $400 a month for her supplement plan. And every year it goes up a little, but she uses it. And so it makes sense for her.
Right.
Okay? And everybody's different. Let's just say that. Everybody's situation is completely different. So that's the supplement. Now, a supplement can't pay on anything that Medicare doesn't approve of.
Okay.
Okay, so if Medicare doesn't approve of a charge, the supplement isn't going to pay for it either. One thing supplements don't cover, or Medicare, excuse me, one thing Medicare doesn't cover is prescription drugs. If all you have is Medicare A and B, your little red, white, and blue card, if that's all you have, there is no prescription drug coverage. Wow. So in order to get prescription drug coverage, you have to get a Part D, Medicare Part D plan, okay? And that has a cost to it. Now the Part D plan is probably, it could be anywhere from a few dollars a month, $7, $8, $9, $10, up to more than $100 a month. Again, it's very individual and it depends on the medicines that you're taking. And we'll get back to that because that's critically important. So if you want this route over here, you have Medicare, a supplement, and a drug plan, and it's going to cost you, let's just say somewhere to start, $140 to $160 a month. But over the years, it's going to go up a little bit to, you know, who knows what. There are people, many people watching this are paying $200, $300, $400 a month for the supplement because they've had it for a while and it's gone up. So that's the supplement track. Now, if you have a supplement, all this Medicare open enrollment stuff, annual election period, doesn't affect the supplement. Has nothing to do with the supplement. But it does definitely have to do with the drug plan.
Okay.
And we can address that.
But you can change the supplement, yes?
You can change the supplement once you've got it, but if you're not in a guarantee issue situation, which most people aren't, then you have to go through medical underwriting, which means that they can turn you down. They can say, no, you know, you had a heart attack last year, 2 years ago, 3 years ago. You had stents a year ago, 2 years ago, cancer, COPD, emphysema, you're on oxygen, or any combination, insulin-dependent diabetes. Now, it's not like, oh, you have allergies, we're not going to accept you. You know, the questions, they're fairly significant. The issues they will decline you for, but you can be declined. So when you first age into Medicare, you can get a supplement, no questions asked, regardless of how sick you may be. I tell people, you know, you can have horns and a scaly tail. But if it's an open enrollment situation, a guarantee issue situation, then they have to accept you,
Right.
warts and all. But after that window has closed, then you have to go through medical underwriting. And you can do that at any point in the year with a supplement. The drug plan and the advantage plans, which we'll get to in a minute, this time of year we're getting into is when you want to review the current plan and decide, do I want to stay with it for 2023 or do I want to change it? And that's something that everybody should do. You have to save money. You really need to evaluate that. So I'll stop there and see if you have any questions about the supplements or that way to go.
Right. I don't even think I knew about the supplements. I am that ignorant on the subject. I just thought it was Medicare, A and B, and then the
Something.
yes.
The something. Okay.
something.
Well, the supplement is one of the somethings.
Okay.
All right. Well, let's talk about the other something.
Yes.
In 2006, Congress passed whatever it was called, and it created officially, and it started in 2006, so it would have been before that, but it created Medicare Part D, the drug plan, and Medicare Part C, which most people don't realize is the Medicare Advantage program. Prior to 2006, there was no insurance coverage for seniors and their prescription drugs. There wasn't anything. Now, some of the supplements, the old supplements,
Yes.
prior to 2006, some of them had some drug coverage built in, but not all of them. So I literally, when I started in the business in 2002, I was sitting down with seniors who had no coverage for drugs, and it was, do I feed the cat this month or do I take my metformin?
Right.
Right? And so 2006, the Part D plan was launched, and so it's with a private insurance company. The Part D and the Advantage programs are all private insurance companies. So since 2006, we've had the Part D and the Medicare Advantage program. Now, Medicare Advantage plans, probably the best way to describe it is they're kind of like major medicals. Okay? It is a standalone health plan. But you have to have Medicare A and B in order to get it. The thing where people get confused is, whereas with your supplement, if you filed a claim, the claim would go to Medicare and they would pay. Then the claim would go to the supplement and it would pay. And then if there was a little left over, you get a bill.
Yes.
All right? So potentially 3 payers. On the Medicare Advantage side, the only payer is the insurance company, except what copays you may have.
Okay.
Medicare pays nothing on the claims like your husband's plan.
Right.
If he goes in the hospital, I'm not going to say what his plan is,
Right.
but he has an Advantage plan.
Yes.
If he goes in the hospital or to the doctor, the claim is filed to his company, his insurance company,
Okay.
not Medicare. And if there's any left over, he may have had a copay up front, or he may have some co-insurance or something after the fact.
Right.
Okay. But Medicare pays nothing on the claim. Why is that? Why does Medicare not pay on the claim?
Right.
Well, your husband doesn't pay anything for his plan. Many Medicare Advantage plans have a 0 cost per month.
Right.
Okay? So it's free? No, it's not free. It costs the client 0. Now, some have a small cost, but let's just say 0, because most of them are 0.
Right.
How does that work? How in the world can you have an insurance plan with all these benefits?
How does that work, Will?
How does it work? Well, the government is paying that insurance company to take care of your husband vis-a-vis paying for his health insurance plan. Now, people say, well, yeah, he's paying $170 a month for that Part B.
Right.
So they're getting that. Well, it's a lot more than that. It's actually probably closer to $800, $900, $1,000, $1,500 a month. It is a sliding scale. I don't know the numbers. It depends on where you live. It depends on, in some cases, the health of the person, if they're in a more expensive medical cost. But one way or the other, Let's just call it $1,000.
Okay.
The insurance company is getting $1,000 a month to take care of your husband. All these advertisements that are out there, the Joe Namath, the William Shatner, the Jimmy, well, all of those are for Advantage plans. And all those, by the way, are national agencies that want people to call so they can enroll them in a plan through them.
Yes.
And more times than not, they don't get in the right plan, at least from my experience. They don't get in the right plan. And these people are not local. I actually toured a telemarketing facility called Go Health, which is one of those. I don't know which commercial, but it's massive. And I went into a room. There were about 500 people in cubicles in this room, all of them licensed, talking people into buying whatever plans they were selling. To get the most, you get what you deserve from your Medicare, right? It sounds so good.
Yeah.
And after you hear it, on the Western Channel, my father-in-law would sit and watch the Westerns, and I would sit and watch Westerns with him for a couple of hours, and we would just talk. And every other commercial was that. And every other one was, have some sort of guarantee-issued death benefit, right? Which is a whole other thing. But they're inundated, you're inundated, and when you're sitting at home and you just, after a while, it's like, it used to be when we were kids, call Columbia House and get the 20 records for a dime, right, or a penny or whatever, right? Finally, you couldn't take it anymore. I'm going to do it. It's the same thing.
Yes.
All right? But that's what it is. It's marketing. They want you to take action, and then they're going to try to change the plan you're on so that they can be your agent. That's it. I could do that. If I could afford to hire some, old movie star and have them do that, then I could get all the calls, right? They're no different than what I'm doing, except it's on a massive scale.
Okay, I have a question about that because that does come up in the senior community.
All the time.
I mean, and it is scare tactics.
Right, it is scare tactics.
What happens if Bessie and John are sitting at home and they get one of those calls and it's too good to be true and they change their plan and they sign up? Within the enrollment period, can they revert back?
So within the enrollment period, within the next 2 months, right, from October 15th through December 7th, you can enroll in a different plan every day.
Okay.
When the door closes, when the window is shut at midnight on December 7th, whatever the last plan is the one you've got.
And there's no changing it.
And there's no changing it. Well, yes, you can change it.
Are there some life events that?
There are some life events. If you move, you can always change a plan, whether you're moving in or to or out of. And there's also what they call the open enrollment period, which is from January to March. And you get a one do-over.
Okay.
Okay? So if you're in the wrong plan, let's say you enrolled in a plan with the best of intentions.
Yes.
And in December 7th.
Yes.
And you go into January and all of a sudden you realize, wait, my doctor doesn't take this plan. Or these 2 medicines, I didn't look, I forgot about these medicines and they're not covered and this is going to cost me a lot of money. Mm-hmm. Okay, you get one do-over in that 3-month window.
Okay.
All right? But that's it, one. After that, the rest of the year, you're on it till the end and you can change it. But these people call and a lot of people don't have this opportunity to change. And what these commercials are doing is designed to get a lot of people calling, and they'll pick the ones that actually are on Medicaid, maybe are getting what's called low-income subsidy, which is some help with prescription drugs. Mm-hmm. Those people can change plans periodically.
Okay.
If somebody has a dread disease, diabetes, heart disease, there are some what they call CSNP, special needs plans for critical care that you can change. So there are a few things you can do throughout the year, but for the most part, no. Once you're on a plan, that's your plan, which is why it's so important to do it right up front.
Yes.
Now, if somebody does wind up getting switched into a plan in the middle of a year, it's happened to my father-in-law. He's got some dementia. And he got switched into a plan, and I called Medicare. Well, my wife did. She's the power of attorney. Called Medicare.
Yep.
And said he did not he wanted some dental insurance, and they kept talking about dental. So he called and thought, well, I'm going to right. Well, he wound up getting everything changed. It was a big mess. We got it switched back. Okay, we filed a complaint, but all those complaints and there are a lot of them. All those complaints have piled up, and now it's made it a little more difficult on my end. But hopefully, there are some consumer protections. But let's talk about those advantage plans, okay?
Yes.
The important thing is that people really see and hear zero premium. Wow, zero. That's important. That's a lot of money. Mm-hmm. If you've been paying $300 a month, or maybe your husband too, that's $600 a month, and you can both go to a zero-cost plan.
Right.
That might be a windfall for you, but it might not. And that's why we have to sit down and really look at the dollars before we make that determination. Now, if nobody remembers anything else, remember this. The single most important thing that you have to get right are the medicines that you're taking.
Yes.
You got to get I'm going to look right into the camera. You've got to get the medicines right. Not the medicines you think you might be taking 6 months from now, but the ones you know you're taking today. You have to plug those in to the Medicare system, and we do that on every appointment. We would do that on your appointment.
Yes.
You bring your baggie, you bring your list, you bring them all with you, you pull them out of your purse, set them on the however it is, you bring them to me. We look at those and we plug them in and we say, all right, we're going to put them all in, and we're going to choose the pharmacy that you want to use, or the 2 pharmacies, or however you get your medicines. Mm-hmm. And then we're going to hit the magic button. And this is a public website. You could do this on your own, but the problem is you've got to know how to do it.
Yes.
And it's going to, Medicare.gov is going to spit out, in order of cost, relative, the plans. Okay? Mm-hmm. So now you can look down through these plans and go, okay, well, this one costs this, and this one this, and this one this. And maybe they're all very similar. So you get 30 very similar plans.
Right.
Or maybe one of them is head and shoulders better. That can happen, and the reason for that is every plan, every drug plan, every advantage plan has its own formulary, which is the list of drugs that it covers.
Oh, everyone is different.
Everyone is different. There are no 2 plans that have exactly the same formulary.
Right.
In fact, for example, and I'll mention, Blue Cross, Aetna, Humana, WellCare, United Healthcare, okay? All those companies have multiple drug plans, okay? Each may have 3, each of those, but all 3 of those have different formularies even within the same company. And all 3 of those have different cost profiles. And all 3 of those may or may not have deductibles. And all 3 of those, the premiums are going to be different.
Right.
So we have to drill down to exactly which one.
Wow.
You know, you may want to pay $7 for a plan, but and that may be great, but the cost for the drugs may be up here. Whereas this other plan may cost $75 a month, and you're like, gosh, that's a lot per month. But if you look at it over the course of a year, it's actually lower. You're paying $75 a month versus $7 a month, but the cost of drugs here is this much, and the cost of drugs here is this month. And what you have to do is take it on a 12-month and look and see which one's going to make the most sense. So it's not just, again, it's not close your eyes and point. You know, now if you don't take any medicine and you don't go to the doctor and you don't really care, then, great, whatever, pick one.
Then you can do that.
Pick one, right.
Well, we're kind of out of time here. We're either out of time or going to a break. I'm not quite sure. Somebody could let me know.
Somebody
let me know.
Bueller?
Are we going a break or out of time? Out of time. Oh, my gosh.
Great.
Well, then let's get to this, Will.
Let's get to this.
This is the important stuff.
We've gotten to the good stuff here.
Okay.
We've gotten to the important stuff. There is never a cost for somebody to help you with your Medicare.
Yes.
Okay? If you come to see me, I could never charge you.
Right.
And there's no advantage to going your own way, cost advantage. Get help. Go see somebody, an agent. Go see them that knows what they're doing. So Medicare costs for next year actually going down. Your Part B costs next year.
Yay.
Not a lot, but again, every dollar counts. It's dropping from $170 to $164.
Okay.
There's some cents in there. So it's going to save you a little over $5. And then the Part B deductible is going to be down about $7.
Okay. I'll take that.
So yeah, it's a little lower. Let me just say this.
Yes.
If I can help you, call the phone number, our phone number. It's very simple. It's 479, so Northwest Arkansas, 855, which is the old tried and true Bella Vista Exchange, right? 479-855-MEDI, M-E-D-I, which is 6334.
All right.
479-855-MEDI. We were already booked up a lot, but we've got all the way up till December 7th to do whatever, so don't go it alone. Get some help from somebody that you trust.
Please, yes. I want to thank Will for coming in. I really do appreciate. He is the expert on this. Give him a call. Go and let him assess what you have. If you need to make some changes, cannot stress enough about the medications that you're taking. Please go and see Will or whoever. If you're dealing with another agent, go see that agent. But definitely get a little tune-up and see whether that's the right plan for you.
And let me just interject real quick. If you're diabetic, you need to come see me.
Okay.
If you're on metformin pill control or insulin control, it's going to be a good year for you next year. That's all I can say because we're not to the first yet. But if you're diabetic, 479-855-MEDI, and we can visit.
You heard it here, folks. Thank you so much. We'll see you next month. Bye-bye.
Remember, you can see this program on Wednesday, Thursday, Friday, and Saturday at various times. You may also view this program on YouTube.com by going to Bella Vista TV. This show has been a presentation of Bella Vista Community Television. Thank you for joining us.